Have you ever needed a prescription filled, only to find your local pharmacy closed? It's a scenario playing out more and more across the country. But what's driving this trend of pharmacy closures? To understand, we need to look at the economic realities facing the industry, the changing landscape of healthcare, and the role of major corporations. Major pharmacy chains, including CVS and Walgreens, have announced plans to close hundreds of locations, citing factors like market saturation and changing consumer behavior. These closures are happening nationwide, but the impact is often felt most acutely in rural communities, where access to healthcare is already limited. The situation is particularly dire for elderly patients, people with chronic conditions, and those with limited mobility. The trend of pharmacy closures isn't just about business, it's about people. Access to affordable and convenient healthcare is essential for everyone, and pharmacies play a vital role in ensuring that access. Many pharmacies are facing a perfect storm of rising costs and shrinking margins. One of the biggest factors is the rising cost of prescription drugs. Pharmacies are often caught in the middle, paying high prices to wholesalers while facing pressure from insurance companies and patients to keep costs down. Adding to the pressure is the complex world of insurance reimbursements, which have been stagnant or even declining. Pharmacies also face rising operational costs, making it increasingly difficult to stay afloat. The COVID-19 pandemic delivered a significant blow to the pharmacy industry. The early days of the pandemic saw a surge in demand for medications, straining supply chains and leading to shortages. Pharmacies had to adapt to new safety protocols and invest in personal protective equipment, adding to their financial burden. The pandemic led to a decline in foot traffic, translating into lower sales for many pharmacies. Even as the pandemic has eased, some changes in consumer behavior have persisted, making it more challenging for pharmacies to regain their pre-pandemic levels of business. As more pharmacies close, the remaining ones are left to shoulder the burden of serving a larger patient population. This can lead to longer wait times and increased workloads for pharmacists. The trend also raises concerns about the future of personalized care, as patients may increasingly rely on automated systems and telehealth consultations. What's lost in the digital shift? As technology evolves in medication management, the human element of healthcare is often overlooked. Online pharmacies offer benefits, but can create a sense of detachment. Traditional pharmacies provide human connection, knowing patients' names and needs. These brief interactions can significantly impact patient care. A pharmacist is more than just a dispenser of pills. They offer personalized advice and identify potential drug interactions. They provide health screenings, immunizations, and trusted health information. Personalized care, built on trust, is hard to replicate digitally. When pharmacies disappear. Imagine needing a prescription filled, perhaps for a child with an ear infection or a grandparent managing a chronic condition. You head to your local pharmacy, a place you've come to rely on, only to find it's gone. Another casualty in the wave of pharmacy closures sweeping the nation. Experts call a pharmacy desert, a geographic area where residents face significant barriers to accessing essential medications and pharmaceutical care. Obtaining a simple prescription can turn into a logistical nightmare. They may have to travel long distances, sometimes hours round trip, to reach the nearest pharmacy. For those with limited mobility, relying on public transportation, or juggling work and family obligations, these barriers can be insurmountable, and the consequences of these barriers go far beyond inconvenience. Delays in filling prescriptions, missed doses, and even medication non-adherence can have serious implications for patients' health, particularly those managing chronic conditions like diabetes, heart disease, or mental health disorders. The local pharmacist is more than just a dispenser of pills. They're a trusted advisor and a vital source of health information. In an era of mega pharmacies and online delivery, the independent pharmacist stands as a beacon of personalized care. They know their patients' medical histories and concerns. They offer a listening ear and a compassionate heart. This personalized touch makes all the difference in patient care. It fosters trust and empowers patients to take an active role in their health. The domino effect of closures. The ripple effects of pharmacy closures extend far beyond the immediate impact on patients in pharmacy deserts and the erosion of personalized care. As pharmacies shutter their doors, the remaining pharmacies, often already operating on thin margins and facing staffing shortages, are left to shoulder the burden of serving a larger and increasingly complex patient population. This influx of new patients can strain resources, leading to longer wait times, increased workloads for pharmacists and technicians, and a greater potential for errors. Imagine a pharmacy accustomed to serving a few hundred customers a day, suddenly faced with double or triple that volume. The pressure to keep up with demand can be immense, potentially compromising the quality of care and increasing the risk of mistakes. Moreover, the closure of pharmacies can exacerbate existing disparities in healthcare access and outcomes. Low-income communities, rural areas, and communities of color, already disproportionately affected by health disparities, are often hit hardest by pharmacy closures, further limiting their access to essential medications and healthcare services. This domino effect highlights the interconnected nature of the healthcare system. The closure of a seemingly small business like a local pharmacy can have far-reaching consequences, impacting the availability of medications, the quality of care, and the overall health and well-being of entire communities. Protecting your health in a changing landscape. As the pharmacy landscape continues to evolve, it's more important than ever for patients to be proactive about their health and to advocate for their needs. Here are some steps you can take to navigate this changing terrain and ensure you have access to the medications and care you need. Stay informed. Keep abreast of changes in your community, such as pharmacy closures or new healthcare options. Check local news sources, community bulletin boards, and your healthcare provider's website for updates. Build relationships. If you have a trusted pharmacist, nurture that relationship. Let them know you value their expertise and personalized care. Communicate openly about any concerns you have. Explore alternatives. If your local pharmacy closes, research alternative options, such as nearby pharmacies, mail-order pharmacies, or reputable online pharmacies. Compare prices, services, and convenience factors to find the best fit for your needs. Ask questions. Don't hesitate to ask your doctor or pharmacist about your medications, potential side effects, or any concerns you may have. Your health, your choice. The future of pharmacy may seem uncertain, but one thing remains clear. Your health is your responsibility. While we may not be able to control the forces shaping the healthcare system, we can empower ourselves with knowledge, advocate for our needs, and make informed choices about our health and well-being. This means staying informed about changes in your community, building strong relationships with healthcare providers, exploring alternative care options, and never hesitating to ask questions or voice concerns. It also means recognizing the value of personalized care, seeking out providers who prioritize your individual needs, and advocating for policies that promote equity and accessibility in healthcare. By becoming informed advocates for our own health, we can help shape a future where access to quality care is not a privilege but a right, a future where technology complements, not replaces, the human touch in healthcare. Join us for more important health information.